Yes. So behind the iris, we have the lens. And when we're born, this lens is crystal clear, and its function is to focus light. So when we're focusing in and out at different distances, that is the lens expanding and contracting.
Mm.
Um, in order, well, the muscle that controls the lens allows the lens to expand and contract in order to allow us to focus at different distances. Over time, that crystal clear structure starts to become a little bit opaque, becomes a little bit yellow, becomes a little bit opacified in a way. The way I describe it to people is if you leave a piece of clear plastic out in the sun, that will start to go a little bit yellow. And that's kind of what happens to the lens, because one of the biggest factors for that is UV radiation and a lifetime's accumulation of UV radiation. So, what that means is if you live long enough, you will get a cataract.
Mm.
It's pretty simple as that. Even if you wear sunglasses all the time, even if you're very careful with UV protection, you're still going to get a cataract. However, UV protection, of course, is important because we can delay the onset of those cataracts. The oldest person I've ever referred for cataract surgery was 95 years old.
Wow.
I saw someone a couple of weeks ago who was about 92, and his lenses were still in really good condition and only a little bit yellow. He still had excellent vision. The youngest person I've ever referred for cataract surgery was in their 50s, I want to say. Um, Now, there are different types of cataracts. It's not all just a yellowing and kind of like a filter appearance. We have sometimes more aggressive types of cataracts that are a bit more fast developing. The fastest cataract I've ever seen, I saw someone in November or December of 1 year, and she had very, very early signs of these fast growing cataracts. By the time we got to about March, her vision had deteriorated to about a half to a quarter of what she was when I saw her in December, or November, December. I referred her to a surgeon, and she saw the surgeon less than a month after I referred her, and her vision had halved again from when I had seen her the second time. That's very uncommon to see it progress that fast. But she had a very aggressive type of cataract. Those types of cataracts are a little bit different because they start at the very center of the back of the lens, and that is where a lot of that light is really focused through. So if a cataract is more diffuse,
Mm.
what we'll have is kind of like looking for it through a filter, where light is not coming through that lens as clearly, as crisply as ideally it should, and the light is kind of diffracted out. And we start to get some of those, maybe a little bit of halos. It might be that contrast is a little bit down, so people will start relying on light um, and bright lights to help with their reading. Oftentimes, someone will say to me, "Yep, I can't read the paper, but if I go outside and I angle it just right, I can read the paper." And it's just because a lot of that light is allowed and easy to see. With those more aggressive forms of cataract, it's just smack bang right in it, and it can make things very difficult. There's then other types of cataracts that start on the outside and gradually work their way in, like little spokes of a tire, just gradually working their way in. When I was in Nepal, I saw some of the most advanced cataracts that I will probably ever see. Um, Part of the reason for that is access to healthcare. And so a lot of these people have what we would consider um, pretty, moderate to severe cases of cataracts. And for them, we couldn't refer them to for surgery because people had much more severe cataract that had to be triaged and prioritized. And in those advanced cases, that's when we really see that milky white appearance or the brown appearances. I think I can count on one hand how many of those I've seen in Australia, whereas I could count on one hand how many I'm seeing in a couple of hours while I was in Nepal.
Mm.
So it's chalk and cheese. But with cataracts, most of the time they're very slow growing. You could take decades to get to a point of needing to do anything. Just because you've had cataract when you're 55 doesn't mean you need to do anything about it. Could be, in your 80s, potentially by the time we need to actually do something about those cataracts. So a lot of the time they are just really slow growing. All we do is monitor. We don't need to touch them. There are three reasons that I generally refer people for cataract surgery. One is if they're preventing me from being able to perform a proper eye examination. And that would be that if I can't see inside of your eye properly because the cataract is making it hard for me to inside of your eyes, and I'm worried about something, maybe you have diabetes and I want to check for diabetes damage and I can't see it properly, maybe you have some other sort of eye disease that I can't monitor properly, that's a good reason for us to try and monitor, to refer. Equally, if that cataract is causing damage at the front of the eyes, where it can be leading to increased eye pressure and then following on to things like glaucoma, that's another good reason why we might want to refer. Another reason we might send someone away for cataract surgery if they can no longer drive or they're getting pretty close to their driving limits. Um, Cataracts can be quite socially disruptive because it can really impede on someone's independence if
Mm.
they aren't able to drive anymore, or maybe they're getting so much glare at night that they can no longer drive at night and it limits some of their social activities. Um, so that's a discussion I often have with patients when they have those sort of cataracts, and is it affecting their functional life,
Mm.
um, regardless of whether they drive or not? Because sometimes someone doesn't care about whether they can legally drive or not because they've never driven, and so we're not going to have to consider that. But maybe it's affecting them because they can't go out at night. Usually, their husband or their wife or their partner will take them out. Maybe it's not got anything to do with that. Maybe it's that they can no longer read properly regardless of the life. Maybe they're having trouble doing some of their hobbies that they've been doing for so many years, and that can become quite debilitating for some people, um, depending on how it's affecting them. So that would be the third reason then that I often send people away for cataract surgery. Um, and when I say sending them away for cataract surgery, what I mean is that we refer to have a discussion with the ophthalmologist um, about having cataract surgery, because not everyone needs cataract surgery. Just because, as I said, just because you have cataracts doesn't mean you need it. Some people, especially early on in my career, I was over referring people for cataract surgery, I think. Um, they had what I thought was significant cataracts. They'll go see the ophthalmologist, they'll have the discussion with the ophthalmologist, and they'll decide, they're functionally fine. They don't Driving doesn't matter to them because they don't drive. They're able to do all their activities. We're still able to get a good enough look inside of their eye. It's not causing any damage. And so for those cases, we don't necessarily need to perform cataract surgery. Having said that, there are some people who would prefer just to have the cataract surgery because it might mean that there's less dependence on their glasses, and that might be a convenient factor for them. That's a little bit complicated because there's a little bit that goes into that, but um, you know, there's a lot of different factors. But I think the moral of that, or the key message there, is just because you have cataract surgery, just because you have cataracts, doesn't mean we need to do it.
Mm.
But there are, similar with macular degeneration, there are environmental factors that always play into this. Something like smoking. Smoking increases the risk of a lot of different eye diseases, such as macular degeneration, such as cataracts, such as increasing the risk of something like diabetic retinopathy. And so the smoking is something that is a modifiable risk factor. UV radiation, as I mentioned, everyone will get a cataract at some point. If we can protect our eyes with really good quality sunglasses, then that's going to go a long way in reducing that accumulated exposure and prolonging the onset of those cataracts. Not
Mm.
stopping them, not reversing them, but prolonging the onset.